Thank you for tuning in to watch our Invest Tampa Bay 6th edition Leadership Summit. You're about to watch panel number 1, Future-Proofing Health, what Tampa Bay's rise as a global healthcare hub means for communities and the role of innovation in meeting greater demand. Don't forget to like and subscribe to watch more leadership insights like these. Enjoy.
Well, thank you, Abby, and good afternoon, everybody. Thank you. Thank you. So good to see everybody. Really, I'm honored. And so I know the first question on your minds is probably, why is the mayor of Temple Terrace opening this up? Why is he presenting the first panel? See, and that's a good question, right? For those of you who are in the healthcare, I like that you ask questions. So honestly, I had the same question when Ryan first called me about this and said, hey, Andy, would you do this? And I said, well, yeah, sure I will, but where's Mayor Castor, right? I mean, we're deep in the city of Tampa, and shouldn't this honor go to Mayor Castor? And he says, well, we called her. And so, but she had a previously arranged meeting today, and she couldn't reschedule, people out of town. So I said, well, that's understandable. Mayor Castor is very busy. What about Ken Hagan? And he said, well, we called Ken too. And Ken had some meeting about, I don't know, some kind of indoor sports thing or something. So Ken was unavailable. I said, well, I've got an idea. How about RIA Law, right? Everybody knows RIA Law. Fantastic. USF, medical stuff, great. So, well, we called RIA and said, first week of classes, week of welcome, all that stuff. So that didn't work out. I said, well, I know Charlie Lockwood. Everybody knows Charlie. He's a great guy. Well, yeah, but Charlie was golfing today. So he said, let me just save you some trouble. So then we called the director of the Pet Resource Center. But he's out of town. So then we called the treasurer of the Tampa Garden Club. She didn't return our call. She said, but I swear to you, this Ryan said, he said, I swear to you, you were absolutely the first person we thought of after that. And so I'm very honored to be here in all seriousness. How can you turn down an invitation like that? So thank you. So I do have to tell you, in all reality, it's a very humbling experience, and I'm very honored to be here to present, first of all, to talk to such an esteemed audience, but also to introduce such distinguished panelists. And so I know some of them. I don't know all of them, but I do know some of them. And so it is a great honor. And to give a legitimate answer to the question of why is this Temple Terrace guy up here? So there is a real answer to that, by the way. And the answer is, our region has had such phenomenal success really for the past couple, really 15, 20 years, the past couple of decades really, but especially since COVID. And things have really, I've seen different numbers about how many thousands of people a day have been coming into Hillsborough County. Depending on the year, that changes up or down a little bit, but whatever it is, it's a lot. And so this is a tremendous economic boom to our region, and it's been good and bad, depending on your perspective, but I would say mostly good. But even success on this scale creates some new challenges, right? And they're all interrelated. And the challenges are, the medical industry is certainly a big part of that. And if for those of you who've lived in Hillsborough County for a long time, I grew up here, I mean, this is light years ahead of where we were 20 years ago. But the challenges then become, okay, workforce, because you have to have thousands of workers that are skilled workers that can do this type of work and other types of skilled work. So we have to have a pipeline of talent. Then we have to have workforce housing, which we've all heard a lot about recently. It doesn't do any good to bring workers in if they can't afford to live within 50 or 60 miles of where they work, right? That doesn't work. And then we have to have transportation. Ooh. Right? That's our Achilles heel in this community is transportation. So these challenges and all the other associated challenges, these are not isolated to the city of Tampa. They're not even isolated to Hillsborough County. Really, we work a lot in the Tri-County region, Pasco, Pinellas, Hillsborough, but really this is for the whole MSA. These are regional, tough, hairy, 800-pound gorilla kind of problems, and they're not just for one political body or one sector of the economy to solve this. So the question is, why is the Temple Terrace guy here? Because it takes all of the stakeholders in all of the sectors to be in the room at the table when we're talking about these things. Because what works in Trilby does not necessarily work in downtown St. Pete or downtown Tampa or Plant City. So we all need to be around the table and engaged, whether you're a big city, Tampa, whether you're the Hillsborough County government, Pinellas County, or whether you're from Trilby or Temple Terrace in Hillsborough County's case. You know, we're the third largest city in the county. Well, there's only 3 cities, guys. The third largest city in the county. But no matter where you're from or what industry you're from, or whether you come from a big company or a smaller company or an upstart or a consulting group, hospital, it doesn't matter. We all need to be engaged in the discussions about solving these problems. And I will tell you that the government, politicians, which right? That's not a good word. Politicians is that's like, no offense to Jim Schimberg's here somewhere and all the other attorneys, but that's like that's below attorney, right? I mean, there's more jokes. Politicians are, but I have to tell you, in all sincerity, that I work with lots and lots of local elected officials, particularly local officials and maybe at the state level. There's some really, really good meaning public servants in local elected office, I will tell you. We might argue, but everybody that I know of, with maybe a couple of exceptions, but they're really sincere people that really care about their community, or they wouldn't be willing to do what they're doing for $10,000 a year or whatever. So, you know, I know it's unpopular to defend public officials, but I will tell you that we are all working together in this region, Pasco, Pinellas, Hillsborough, Tampa, St. Pete. When you hear us stand up, as you will when it's hurricanes and Super Bowls and stuff, say, well, you know, we're really good at working together. We really are. That's not just Mayor Castor saying that. We really are. We really do work together. So big and small, thank you for being here. You are all part of the solution. I guess in some perverted way, you're part of the problem too, but that was a joke. Don't take offense, right? So I am honored to introduce some people that are coming up first. And I don't know how to do this because it's a long way from there up to here. So just stay put. And then after I get done with their names, we will drown them with thunderous applause. And during that standing ovation, they will make their way up the steps to right? Does that sound like a plan? Okay, so the first person, if you would just stand at your table, but don't make your way up yet, because then we'll be falling all over each other. But Phil Dingle is going to be the moderator for this. Where's Phil? There's Phil. Phil is the managing partner for Health Edge Investment Partners. Next we have, I think everybody knows this guy, and that's John Couris, President and CEO of Tampa General Hospital. We have Jonathan Fleece. Where's Jonathan? There we go. President and CEO of Empath Health. And Alicia Schulhof. You guys did good. You're sitting right next to the steps. She's the president of Johns Hopkins All Children's Hospital. And Linda Ward is the president and CEO of Gulfside Healthcare Services. So now is the time when we'll drown them with thunderous applause while they make their way up.
Welcome today, the first panel, and when I saw that it was future-proofing healthcare, I wasn't quite sure what that was going to all be about, but then I thought about this town of Tampa where I grew up, and it was so small and unsophisticated decades and decades ago, and I'm an old guy, so I've seen a lot of change, and we have moved in a light year speed, really. When you look at what we're doing right now, we are smoking hot, and we're smoking hot in part because of people like our panel here today. And if you think about technology in general and what's happened over the past 30 years, where we had these big mainframes and CPUs and all these computer things, and now our lives revolve around this phone, which, by the way, if you look at it, it has an apple on the back with a bite taken out of it. That reminds me of Satan and Genesis, but we're not going to go there right now. Healthcare has been moving at the same rate of speed. And so part of what we're going to talk about today is how these executives respond to some of the challenges, because Tampa has grown massively over the past 10 years, and people like me who are over 60 are aging, right? And even though I can say to myself, I'm never going to let the old man in, the truth is, you know, I'm going to have care. I'm going to need care as we go forward. Now, the folks up here are much younger than me, and we have an esteemed panel that I'm very, very happy to be monitoring. And what I'm going to do here is start out with a general question. And what we're going to do is, first of all, look back at kind of history. Then we're going to talk about today's current state, and then we're going to talk about what we need to be doing in the future to accommodate the growth and the aged population here in the Tampa Bay area. We ready? We ready to go? All right, my first question, and it's going to be to all of you, and ladies first. So Linda, I'm going to start with you. Down at the end is, in one short sentence, what makes Tampa Bay's healthcare landscape stand out nationally and locally?
Okay, is my mic on? Hi, everyone. Nice to be here. Well, locally, I will say that, in addition to the rapid market growth here in Tampa, in the Tampa Bay market, and economic strength, I really think that it is that community-centered approach to patient care and collaborative relationships that we all have. It's really setting new standards for how to provide direct care to people in need compassionately, efficiently, and with equity.
So we didn't look at one another's answers, but I think we're going to all feel some common themes today, and I agree. I think it's really about the uniqueness of growth. Not every county or city across the United States has that exciting growth mantra that we are all in the midst of. I also think that we have the best care that's offered right here, and specifically from the pediatric lens, no child needs to leave the state of Florida to receive the care that they deserve. And I think the adult healthcare providers could say the same thing. And then the last piece is really that collaboration. Just looking around the room and looking around this panel, this is a group that collaborates together. As much as we might compete, we have to collaborate because that's how we're going to achieve our goals.
Jonathan, by the way, I have your book in my library, okay, so we have high expectations of your answers here. And by the way, move to globally as well and how we're perceived.
Thank you, Phil. It really is a pleasure to be here, and thank you all for carving out your valuable time to learn about these important issues. So I'm going to pivot quickly in sort of my perspective and refer to a great company in the Tampa Bay region, the Blooming Brands. And for those that certainly enjoy Outback and the many brands that fall under the Blooming Brands, there's a reason that they picked Tampa Bay to be their pilot for so many brands. And that is that the Tampa Bay region really represents a true melting pot of a community. From birth to death, the diversity across this community is so representative of not just the state of Florida, but the United States, and to Phil's great point, the world. So I think what's exciting but also challenging for Tampa Bay is, if we are truly representative of the state, nation, and world, how can we best fill the gaps across such a diverse community and the needs of healthcare? And excited to share some of those ideas this afternoon.
Thank you, Jonathan. John?
Well, I think the growth in the Tampa market, and really across the state of Florida, is really impressive. But I actually don't think that makes us special. I think what makes us special is our ability to innovate, collaborate, and partner. A great example of that innovation and that collaboration and that partnership was the pandemic. We quickly assembled as health systems, HCA, Advent Health, Baycare, TGH USF, Orlando Health, All Children's. We came together and transcended competition. We collaborated, we innovated, and we partnered where it was appropriate to safeguard the health and wellness of the community. I think those are the things that make us special, Phil. Lots of places around the country did lots of innovative things, but very few were able to do what we did at scale, and I think that makes us very special.
And our community definitely benefited by that. The blessings of having so many leaders coordinate during that difficult time period was spectacular. So as the demand grows, but the resources tighten, how are you rethinking delivery models and staying patient-centered, but also supporting healthcare for our entire community, which means all the people, such as sitting here? And John, why don't you go first?
Well, how are we scaling to meet the needs? Well, a couple things, just thematically for contextual purposes. Number one, I think as fast as our state is growing, I really don't think the whole notion and idea of being bigger is better. I think better is better. If you look at the average utilization rates of hospitals across the United States, particularly this region, you may find this hard to believe, but the occupancy rates of the average hospital in Tampa Bay is somewhere between 55 and 65%. Now, this is all publicly reported data. You can go out to the state, you can go out to ACA, and you can pull all this down. Now, there are some exceptions to that, but we don't have a short supply of beds. Actually, I would submit to you that in most parts, not all, but in most parts of the state, we're overbedded. So I don't think bigger is better. I get why people say it, because that's an old paradigm that people like me, you're right, I'm not as old as you, but I'm right behind you. And you know, you have to understand that when I grew up in the industry, it was all about build, build, build. That's how we were compensated, that's how we were bonused, that's how we were evaluated generally. How big can you get? That's an old paradigm. It's really about creating real value for the community, driving better quality, better health outcomes, better safety and service at a better cost, so we can pass it on to all of you in this room that either own or run businesses, right? Through lower cost and better quality. And that's the journey that I think as an industry we need to be on. So our strategy, just to put a finer point on it, is an asset-light strategy. I mean, don't get me wrong. When I got here 8 years ago, we were 1 hospital and 17 locations. Today, we're 7 hospitals, close to 200 locations across the state of Florida, I might add, and with USF and USF Health and the Mersani College of Medicine, we built an academic health system that spans not just across Tampa Bay, but across the entire state, collaborating with organizations from all over the country, including the Mass General Brigham, who we've been working with for 4 or 5 years. So I think it's more about that kind of work, in asking ourselves as leaders, how do we drive quality up in a sustainable, reproducible, highly reliable way, and how do we lower cost and pass the value on to the consumers, either the patient, the payer, or the employer.
So thank you, John. So Jonathan, at Empath, okay, how are you rethinking your delivery model and to improve patient care and to make sure they are the focus on what you're doing?
So at Empath, we are honored and privileged today to be serving 1 out of 5 Floridians at the end of life across the state of Florida now. But I think what we're doing from an innovation and a forward-looking perspective standpoint is reimagining what does end-of-life care really look like. So many of you, I'm sure in this room, have had families, loved ones, friends touched by many of our legacy hospices. Suncoast Hospice, Tidewell Hospice, Hospice of Marion County, hospices on the East Coast now under the Trustbridge brand. But there is so much living that can be achieved through the process of end of life that's how we are reimagining what end of life care looks like. And sadly, we have tremendous partnerships with All Children's and Hopkins through our pediatric programs, all the way through senior living communities, these great healthcare systems that are represented here today, TGH, Advent, HCA, Baycare, you know, all of them, because we're proud to take care of those that are 100-plus-year-old as well. You know, I think what is facing America and what is facing our community, which is nothing short of a miracle, is that we are all living longer lives, and I think we should celebrate and be super happy about that as a community. But then you go to the next level of that question, and it's what quality of life are we living? And what we're doing, I think, around Empath at our full life care model is coming up with a lot of different ways to approach that final chapter. So We have really embraced what in healthcare is referred to as value-based care. Believe it or not, and Phil was kind enough to share a little bit about the book that I wrote, The New Health Age, The Future of Healthcare in America, which is now about 11 years old. And sadly, it's way too relevant 11 years later. But what we have been seeing as the future and now the present of healthcare for quite some time is that the better the outcome in healthcare, often the lower the cost. And when we look at the baby boomer generation, over 10,000 baby boomers becoming Medicare eligible every day now for a decade, we truly have a tsunami coming at us from a social service perspective, both from the payer side, if you're trying to balance the budgets within the Social Security program, and from a community perspective. How are we going to fill these needs? A few months ago, I had the privilege of testifying before Congress and the House Ways and Means Committee on some of the proactive things that we are doing in the non-acute, post-acute care space. And a lot of that, I think, is what we are implementing here in Tampa Bay. So one quick example that we're super excited about, and certainly very connected with the health systems and other community partnerships, is a program called the Program for All-Inclusive Care for the Elderly. Some refer to it as PACE, we call it LIFE. But essentially what we are doing with our PACE programs in Tampa, St. Pete, and then south of the Skyway in the Bradenton, Sarasota area, is we are accepting seniors that would otherwise be in a nursing home, and we're providing care for them as much as we can in a home-based care environment. It is truly all-inclusive care, and it's seniors that, generally speaking, are probably in their last several years of life, but we are 100% responsible for every single component of their care. So that's transportation to and from healthcare, that's for hospitalizations if they need the hospital, that's for their meals, that's for their social determinants of care, to try to avoid social isolation, so through our day programs and other types of engaging type programs, art therapy, music therapy, games. We're here to really make sure that our frail elderly and our seniors aren't falling between the gap. The other thing that we're doing that is innovative, and certainly if there are any insurance companies, MA plans in the room, sometimes they get a bad rap. But at the end of the day, we all know that we have to figure out ways to pay for health care and do it in an effective way. How do we do it through this value-based model? So Empath is also becoming what's referred to as a payvider. So we are one of the first in the area to bring to the entire state of Florida a special needs Medicare Advantage plan just for seniors in nursing homes. So for those that like the vernaculars in healthcare, it's called an ISNP, but what's more important is that we are very, very focused at redefining what end-of-life care can look like and really making it full of life from the moment somebody may get a challenging diagnosis literally to the last breath that they may take. And it's truly a blessing as a not-for-profit organization supported by this community and many, many of you in the room through our foundations to be able to bring a lot of these innovative solutions to Tampa Bay.
So Alicia, you're part of a national organization, you're the local leader, you're taking care of our children. There are many parents here, and our idols are our little children, right? And so how do you think about the changes and the demands that are placed on healthcare in your world and the resources you get nationally as well?
Yeah, I think we are in the thick of our strategic plan. We launched it about 4 years ago, and part of that story is really how we create accessibility to our care and take that care closer to home. We are really proud to serve as the #1 children's hospital in the state of Florida, and we want all kids to have that access to our compassionate, quality-driven care providers. And so part of that is thinking about how to reduce the burden of travel. So we are very very pleased to have turned sand, if you will, in Wesley Chapel for our new campus there. It's also about leveraging technology. We think about where telemedicine is appropriate. That's not the choice avenue for all patients, but it does meet the needs of many. And we've also thought differently and continue to expand services and things like urgent care, or even the growth of our own campus in St. Petersburg, really growing that tertiary quaternary care, so that highest level of care that we can offer our kids while still offering primary and secondary care in other areas. So I think it's this blend and balance of both meeting people where they are and also taking care of our team members. That was another part of your question that I think is so important for every single one of us in the room, is to think about that workforce and how do we continue to be flexible and adaptable and really meet folks where they are, offer even more enhanced programming, even more enhanced total rewards to make sure that we can continue to attract the best talent in the Tampa Bay market. I think that we do that very effectively. We have among the highest engagement at our organization on record, but I think that it's incumbent upon each of us as leaders to continue to raise the bar and to drive that for the Tampa Bay market.
Thanks, Alicia. And so, Linda, last but not least, you have a reputation of providing outstanding community health programs, right? And so the same question to you, how are you thinking about things differently going forward?
Well, from an innovation standpoint, thinking about Gulfside years and years ago, we started as a very small community-based nonprofit, and hospice care in the state of Florida is not a free market. So the nice thing is that there's not over market saturation. And I agree with all of the providers here that it's really about the quality of care, but innovation is so essential. So for Gulfside, a few things that has really stood prominent for us lately is our inpatient care centers and thinking about the innovative ways to help hospitals reduce their ICU days, their mortality rates, prevention of hospitalizations, unnecessary admissions, all those things. But thinking about those patients that have that highest level of care that really is acute care in nature. And so we have partnered with ambulance companies and purchased trilogy units to transport patients on ventilators, come to our care centers, and give the time to the family to fly in and have a peaceful extubation with our physicians, our nurse practitioners. So that's one thing. The other thing is that for Gulfside too, we started at the hospice field, but we have really grown into a continuum of care, post-acute or really pre-acute, for keeping patients in their homes where they feel comfortable living and want to stay. And so our palliative care programs have really taken off. And we've opened clinics, but we've also partnered with hospitals, Kindred and HCA, and to open clinics so that after our nurse practitioners or our physicians do palliative consults in the hospitals and start that advanced care planning, that when patients go home, covering the cost of staffing to go out to patients' home with palliative with very little reimbursement, as Jonathan knows, how do you do that innovatively so that we don't lose those people once they need to continue that chronically ill pain management, symptom control? So we've been opening up clinics within hospitals and rented space. So those are some of the things that we do. And it's really about partnerships. We all partner together.
So thank you, Linda. So now I have some specific questions for each of you that are different, okay? And John, I'm going to go with you first, okay? Anchored by Tampa General Hospital and the USF Medical School, this whole phenomenon of the medical district downtown has expanded, has become a reality, and has really created an atmosphere and an ecosystem focusing on healthcare, innovation, and academic medicine. Tell us what the inspiration was behind that. You've been a driving force, and I know you never want to take credit for that, but tell me the thoughts behind it and where you think we're going with it.
So thanks for the question. So just to take a broader lens, to sort of open the aperture up a little bit, have you ever thought, you're all business leaders and successful ones in this community, in this region, have you ever thought to yourself what makes a world-class city around our country? Have you ever pulled that apart to stay with the medical themes? Like, have you ever looked at the anatomical structure of a city? Ones that are considered to be the best in the country, if not the world. One of those pieces is medical and research districts. Let me give you a quick example. I'm a little biased. I'm a New Englander. I'm from Boston. I started my career at Mass General Brigham, specifically Mass General, and I grew up almost 11 years in the Longwood Medical District in the city. So think Harvard Medical School, Brigham and Women's, Dana-Farber, Boston Children's, Joslin Diabetes Center, Beth Israel Deaconess, and the list goes on and on. One of the reasons Boston is considered the Silicon Valley of biotech is because of its medical and research district, because of Longwood Medical District. It's its academic centers and it's its colleges and universities. And when you look at the city itself, one of the reasons Boston does so well on the global stage is because of those universities and because of those academic health systems. And they don't just support the healthcare industry, they float all the industries and the broader economy in Boston. You can see the same thing in the Illinois Medical District in Chicago. You can go to Houston, to the Texas Medical District, the Texas Medical Center to be specific. You can see the exact same phenomenon happen. So having been born in that, professionally anyway, having been born in that environment, there was a ton of, I was very interested in that because I could see what that center could do. So 6 years ago, I went to the university, went to the dean, went to the president at the time and said, hey, look, we're reestablishing our relationship. So right now, the TGH USF health system is a fully integrated academic health system, fully integrated. Clinically, financially, educationally, research, everything. And I said, you know, we've got a medical school in the city, and our medical school might be one of the most advanced medical schools in the country for sure. It's certainly in the state right now. I think it might be the newest, building-wise and infrastructure-wise. I said, you know, why couldn't we build something in the urban core akin to Longwood Medical District, Illinois Medical District, and Texas Medical Center? Let's make it inclusive. So I'm not interested, this is not a competitive thing for us. This is like a Big Ten strategy. We want lots of people participating. Quite frankly, we invite health systems and payers and universities to all participate in this, but you have to want to do it for the right reason, and the right part of the right reason is to improve the health and wellness of our community, give our city a real identity around healthcare, not only import the care, but export the excellence that's getting created in the city, in the core itself. We've got 3 hospitals in the city now. We've got, obviously, a medical school in the city. We're attracting businesses. We have Medtronic who've moved into our city, who's in our Campbell Center. We're exploring a robot called Hugo. It's for surgical it's robotic surgery for a new platform. We've got Aquafence, which is near, I mean, you do all this stuff and you get known for a fence that keeps the water out of your property. Okay, and then it's funny, after the Aquafence worked, my general counsel said to me, hey, John, we didn't think it was actually going to work, but we didn't want to say no to you. It's a true story. So, but now they moved their national headquarters to Tampa. They're moving their manufacturing to Hillsborough County. We're adding 140 jobs to the community. This is the power of the medical and research district, not to mention the basic science, the clinical research, the translational research that's coming in to the city, and lots more to happen. So that's where the inspiration came from, and it's working. It's working, but it's hard work, it's focused work, and you have to be real disciplined. And I'll leave you with this, it's inclusive, meaning if you want to participate in the right way, we want you in the district. And so we're excited about it, and it's only going to get bigger, stronger, and that's a little bit of the inspiration.
And even Tom Brady left your hometown of New England to come to Tampa. Let it be said.
That's true.
So Jonathan, in your recent, by the way, he loves Tampa more than New England now, just so you know.
That is true.
This is his home.
This is my home.
So Jonathan, you were recently interviewed for the Invest magazine, and you talked about what some of the needs are in the Tampa Bay community, particularly as it relates to end-of-life, terminal illnesses, and how we respond to that. How are you thinking about it nowadays, and how do you meet the demand?
So first, I've got to just thank you, John, for being such a visionary and casting that wide net. I think that I'm going to connect to my answer, but I'm going to connect it sort of this way. So before becoming Empath CEO, my real work was as a consultant and as a healthcare attorney, working with organizations across the country. And at some point, I just felt like a calling, for lack of a better word, to see the future and try to match the future with more end-of-life care. But I want to piggyback on something that's going to jump on John's point. One of the organizations that was part of my research, literally 15 years ago, was the Pittsburgh Medical Center in Pennsylvania. And what was so inspiring about PMC's model is that, much like what John was outlining, is, Pittsburgh is one of those American legendary cities, right? You've got the Steelers, the steel industry. I mean, so much of our 20th century growth represented by cities like Pittsburgh. But what they did that was so innovative is there is a huge segment of the state of Pennsylvania that is rural, between the east and the west side of the state. And one of their innovative models is filling those gaps. And I remember 10 plus years ago that they were in the world of telemedicine and reaching out to the most rural hospitals in the state of Pennsylvania through telemedicine, robots, and going into literally ORs in rural Pennsylvania, beaming in the neurosurgeon from the exact kind of medical center, acute care model that John is referring to, that the urban communities can implement, to basically get to Phil's question, which is how are we filling these gaps in healthcare? And I think the acute care world is it's not easy. Certainly, I would be run out of the room by all the health systems if I made that comment. But the difference between acute care health systems and what Empath does is in acute care there's more of a place, bricks, mortars, like John referred to, in how you deliver care. Well, thanks to the paradigm shift that we've talked already about, that COVID delivered to the world, what is now basically synonymous with living at home. We receive so many services at our home. Empath Health is a home-based care organization. Yes, and Linda's program should absolutely be commended for investing and being an innovator in inpatient care, which certainly Empath is as well. But 95% of what we deliver is home-based care. So what we are doing to sort of dovetail with this sort of full story is we are filling those gaps through innovation, so that when a patient is discharged from a hospital or from a nursing home or from a rehab facility, that we have innovation, we have technology, we have communication, so that that patient doesn't fall into a vacuum that can often happen during this care continuum. Because what happens when patients fall off the cliff in that care continuum? They often will end up right back in the hospital, which is really not good care, and it's not ultimately what we want for this community. So that's one of the programs that we're doing, is really looking a lot at the care continuum and how we can make that a lot more seamless with the healthcare systems and the home-based care solutions that we're offering, whether it was through PACE or other programs. And then the other example that I'm going to use, and certainly want to yield time for the others to answer, is it was mentioned through the mayor's comments how important infrastructure and transportation is. So if you're in the home-based care industry, transportation and the infrastructure for getting from point A to point B is literally life threatening at times and life critical. So for those that have been through the journey of having a loved one at end of life and hospice at home, or for someone that has been discharged after major surgery and you're having rehab and there's been some sort of a complication at home through your home-based care, when your nurse or your therapist is stuck on the Skyway Bridge or stuck on an interstate because of traffic, because of snarl, and you're having to constantly communicate to that family that you're now 30 more minutes away, 30 more minutes away, 60 minutes away, and you can't get to them, that is not only a patient experience and a family experience crisis, ultimately bad things are going to happen in the outcome of that care. So through innovation, we are developing tools like Amazon, where we can literally see where every single care provider is across the Empath footprint, so that if a crisis pops up that's 2 blocks away or close by to another nurse, we can see where that nurse is, and we can automatically, through AI agents and artificial intelligence kind of tools, reroute them so that we can try to get ahead of some of these other tools. So I could keep going, but I'm going to yield to the next speaker.
I'm being told through my inner ear monitoring that I'm about to get the hook here, but I have 2 more questions that we want to address, and first is to you, Alicia. You deliver very specialized pediatric care, as a result of which you draw patients from around the country. How are you translating your success to the entire healthcare ecosystem here in our community?
Yeah, thank you for that question. I think, first of all, kind of tying in what my fellow panelists are saying, it's really leaning into our mission. So we have 4 parts of our mission: treatment, education, research, and advocacy. And I think this role that we play to be a global and national leader in some very unique spaces that no other children's hospital, frankly, in the world can provide, such as our congenital diaphragmatic hernia program. How we're leaning into that is, first of all, on the education and research side, really providing those training environments for others to learn from, that competitive collaboration, opening the doors, making sure that we're providing that avenue for others to really engage with us, learn from us, so that we can carry that care even further beyond our doors. And then also how we continue really to think about some of the other unique elements of our work. We have a biorepository that can store over 3 million samples, and our goal is to get those samples in and then distribute them back out, because we have some of the largest child oncology group studies. So bringing that hope and healing to more kids, because our research and education avenues enable us to do that. And then I'd also like to pull on that advocacy, that role of advocacy that we play in the community. At Johns Hopkins All Children's, we have among the highest Medicaid, not just in the state, but really across the country, as well as the highest acuity. And you put those 2 things together, and that creates a really unique situation for us. And so that opportunity to go and educate our congressional, our legislative representatives on the importance of having funding. You know, the headwinds against all of us, regardless of what industry you're in, but particularly in healthcare, are going to be really significant. And so our commitment and our fortitude to staying true to that strategic plan that we are engaged with, staying true to those investments that we're making, like our Wesley Chapel campus, but even most importantly, true to our patients and their care, and keeping those very unique niche services, those pioneering medical breakthroughs that only few can provide, keeping that available for kids so that we can deliver that hope and healing, I think is paramount.
Thanks, Alicia. So, Linda, I'm going to skip my last 10 questions, but I have one more for you, okay? You've dramatically expanded your community health programs. How have you used innovation to keep up and adequately address the healthcare needs of your patients?
Yeah, for us right now, it's really introducing technology and AI to reduce that administrative cost, more efficiencies. I mean, electronic health records are great, but if you, don't have the integrations to eliminate some of that administrative cost, your nurses are doing a lot more work in the EHR. And then really, I think, we all are suffering from an 11% nursing shortage in the state of Florida, right? And that's thousands of nurses. So what are we doing to maintain and retain? And everyone talked about the relationships with schools, and we're no different. We really work with fellowship programs, nursing programs to not only recruit the best of the best, but what do we do to retain them, empower them, grow them within? And so between technology and listening to our staff about some of their programs, that's where we get a lot of our innovation.
So thank you, Linda. So look, the four of you have very special gifts. You're experienced. You've brought great blessings to our community, and we thank you for that, and thank you for participating in today's panel.
Thank you.